What is the difference between a Medicare supplement and a Medicare Advantage plan? Well, I'm going to tell you. A Medicare supplement is also called a Medigap plan. It literally picks up the gaps in Medicare's coverage and their exposure. You have the Medicare Part A deductible that you're going to have to pay, the 20% co-insurance under Part B. There are skilled facility co-payments and other things. That is your out-of-pocket exposure under traditional Medicare. A Medicare supplement is a separate insurance plan that you purchase that fills in those gaps. Medicare supplements have higher monthly premiums because you're going to pay very little as you go along. You're going to have very little out-of-pocket cost for your health care. Medicare Advantage plans are the complete opposite. You are still in Medicare, but Medicare is not the provider. A Medicare Advantage plan is. Now, this is a private carrier, a private insurance company that's providing coverage to you. Very low premiums, but you're going to pay as you go. You have a co-payment possibly for your doctor's visits, your primary care. You have co-payments for specialists, co-payment per day in the hospital, co-payment for lab work, durable medical equipment. All of those co-payments are going toward an annual out-of-pocket limit. Now that ranges depending on the plan. It could be a few $1,000s, or it could be $10,000 or $11,000, depending on how the services are provided in or out of network. Medicare Advantage plans are managed care plans. They have provider networks. Traditional Medicare does not have provider networks. Almost all the providers in the country, a vast majority of providers in the country, take Medicare. So your supplement's going to follow in behind you. Medicare Advantage doesn't work that way. So there is a difference. Pay now or pay later. But one way you're going to pay. It's like gambling. The house always wins. You have to determine what you feel is going to be in your best interest. What are you comfortable with? Are you okay paying a higher monthly premium for the chance that you might never use your insurance? Or do you want to offset that cost and pay a little bit up front or nothing up front and pay as you go, pay as you're using it? There's no best option. It's what you feel is going to be in your best interest.